We got our Unna boot in a box laid out, and we're going to do bilateral Unna boots, so we got 2 sets. Then we got cast padding, cotton roll, and then we could either do an ace bandage or Coban. So first I'm just going to scrub his wounds here with some betadine. Scrub that, that's an antiseptic to clean. The Unna boot has zinc oxide, which is an antimicrobial, antibacterial, and it's soothing. It comes out cool and kind of wet, but patients like that. Sometimes depending on what they're wearing on their feet, they need to walk out of here in a surgery shoe because they can't fit this big bulky dressing on their foot. So I'm gonna undo one of these and then wrap it on his foot and talk you through this. It's like opening a bag of chips. Sometimes it just gets stuck. So this is messy and gooey. You need to be wearing gloves. And then you find a crease, and we're start at the toes. Not halfway up the leg, not covering the toes, but the leading ledge along the toe metatarsal junction. So I'm not gonna crank the hell out of this. I want a little bit of compression, mild to moderate compression. And each loop, you see how I double back on myself? And I'll continue to show you that. You can step closer so you can maybe look down on it. Now, the next loop, I'm gonna cover half this distance. I'm gonna overlap what I already did. Again, when I get to the top, I'm gonna double back on itself and continue to wrap. Now, we don't need to lift his leg until we get to where it's gonna touch. This will not stain or permanently damage the material here on the chair like the fiberglass will, so we can just wipe that off when we're done as well. The reason we do this is because as he swells, the bandage needs to be able to stretch, and this puts a little ability for this to pull open. Otherwise, this could be too constrictive, and if somebody can't swell, not only could it be unbearably painful and tight, but it could block circulation and result in a lack of oxygen and ischemia, and tissue could die. Now we're gonna lift this up. Put one hand under the heel if you would. All right, so I'm gonna go a little quicker, bear with me. And we're gonna go up to the top of the leg there. And then if I got a little extra at that point, I can start coming down. So nice and smooth, we're gonna pop that open. Start at the toes, work our way up. If you do this well and efficiently, you can get the whole thing wrapped in one layer. If you have a window or you missed the spot, you gotta go back and get it. And then the last one is so we got compression, we got padding. We got the Unna boot, antibacterial, anti-zinc oxide component. Then we got padding, and now we got the compression. This can unravel, so I'm gonna cover this seam up well, and I'm putting some moderate compression as I come up here. Somebody that doesn't have very good pulses, we might wanna go less tight, less compression. I'm wrapping up here, that's it. And I gotta get to the top, and if I can't get that, then I'm gonna need one more ace bandage to get up there. I can't just quit here, so I got that right here. Now, if he came in and it was already unraveled, instead of using this ace bandage, I'm gonna use Coban, because that will stick on there a little bit better for some people. So I get to the top, and then I can just work my way down. Now, where we end this, we got this Velcro, and that puts increased pressure on that spot. So if he's got a wound here, I don't wanna lay it right there. I might relax it and try to get way far away from where that's gonna be. I don't want it on the bottom of the foot because they're gonna step on that and then it can unwind. Then we'll put 2 pieces of tape perpendicular to that blue line, and that will hold it cinched on there the best. All right, good, so you can relax. We'll do the same thing on this side and get you some surgery shoes.